So hello everybody and welcome to a BASW, the very first of our World Social Work Day week and month event. Thank you very much for joining us today. I'm Sam Barron. I'm the Interim Chief Exec for the British Association of Social Work, and a very warm welcome to celebrating World Social Work Day, which starts tomorrow, but for us starts today with this event, with a particular focus on co-building for hope and harmony, central tenets, I think, for social workers and social work practice. Thank you for coming along today. Most importantly, thank you for being social workers, and thank you for the commitment and time you give on a day-to-day basis. And I hope some point, hopefully tomorrow, or maybe during the month of social work, that actually you get a bit of time to yourselves where you can sit and reflect with your colleagues, friends who are social workers, and just think about the fantastic contribution that you've done, because I think sometimes as a profession we're not as good at doing that. So I hope you can take a few minutes to do that. What we wanted to do today to just kind of celebrate social work and celebrate World Social Work Day and week is to just really share with you some of the work that we've been doing around the big conversation, which is something you've probably heard of. And it's something I set off with our Director of Comms, who's on the call, Amanda Gavani. Amanda, do you want to give a wave? Yeah. Looking at really what was the future direction for BASW, where did we want that future to go, and what did we want to focus on. And I'm absolutely delighted that we've had a phenomenal response to that process, and we're going to share that with you today. So today is an opportunity not only to take a bit of time out from a very busy job, hear what we've been doing, hear what the feedback is, but also an opportunity for you to contribute to that feedback. So we have got a few little polls throughout the session, and we have got opportunities for you to have a discussion with members, with staff who are on the call, about where we want BASW to be as a professional association for social work. So if I could just do the housekeeping first. It's a few little housekeeping things that we have to remind people of. Please put your cameras on if you feel able to. Please keep your microphones on mute so we don't get any bounce back or any echoes. The chat is being monitored, and we will pick up any queries or questions that come through the chat. There will be space to talk through and actually raise hands and talk about any queries that you've got, but also to be respectful in that chat. And also the event is going to be recorded. So I hope everybody's okay with that. Yeah. Okay, next slide. I'm going to share with you then what we've done at BASW and where we are with it. So as I said, Amanda and I started this process in November, beginning to think about where do we want the future of BASW to be, what shape does it want to be, what do we know are its strengths for BASWs, and what do we know are the areas that we want to move into. So we developed the big conversation, which was a process of connecting and engaging with the profession. And that connection and engagement has been huge, actually. As you can see in one of the bubbles at the bottom, we've had over 1,300 contact points from people engaging and connecting about the future of BASW. And that has come from a lot of different people. So we've had people with lived experience contribute, we've had members contribute, we've had non-members contribute, we've had a lot of external stakeholders across the 4 nations contribute. We've also been out and talked with some of our membership groups that operate across the 4 nations. So we've actually had a very extensive, really engagement process. What's really interesting, as you'll find from the presentation that we're going to do, is some very broad themes have emerged from those kind of key areas where we've engaged with different groups. And it'd be really interesting in the polls to see what your thoughts are as well in terms of that. Where we're going with this is we're actually building a new future and a new vision for BASW, and that's what we want to do from this. But we wanted that future vision and strategy to be based on what the profession thinks BASW should be doing. It'd be very easy for me as an interim chief exec to come in and write a few words, but actually we are a membership association, and we wanted to harness those views and to really capture what people are saying where BASW needs to be. So that's why we set it up. It finished at the end of February, and Amanda, who's waved as an introduction, has got the hard job of amalgamating all the results, but here are some of the early findings that we've found. So can I have the next slide, please? So headline themes are that members and non-members and stakeholders want BASW to have a simple, valuable, accessible membership experience. I think behind that is that members were telling us it wasn't always clear. And that we need to be clearer about what is offered for different people at different points in their career, and how do we articulate that and ensure that it's relevant. It's relevant for whether you are an NQSW, whether it's relevant for somebody who wants to go into their first team manager position, whether it's relevant for somebody who's got 8 years experience as a very senior practitioner and wants to stay as a senior practitioner. So that was the first one. The second one, to have a clearer identity and a stronger voice and a visible leadership. And this was a lot around our social media, a lot around our campaigning, and a lot about being seen to be very strong on key areas. And this is something that I know Johnny, do you want to give a wave? Yeah. This is Johnny, who's our comms officer, also is very strongly about, and that is something that we've began to shift already. I felt, as a social worker who's been registered just under 40 years now, that actually I wanted BASW to have a stronger voice and to be bolder in its positioning, and that is something that we've actually started to do. We'd really welcome your thoughts on that. Then with third headline theme was about practitioner-centred design of CPD services and campaigns. And that's about making our membership offer much more clearly focused on practitioner knowledge and practitioner skills and practitioner development. How can we support our members to develop as a social worker? And you will see through some of the slides that we're going to show you some examples of what people fed back to us about how that could be done. And that is something that I am particularly keen on doing since coming into post as interim chief exec. In my previous post, I was director of practice improvement for a local authority in England, and it contained the PSW role. So I can clearly see what social workers wanted in their day-to-day development, where BASW can fit with that. Number 4 key headline was around making sure that as membership association we have a modern digital capability. So that was modern capability around our website, and actually how do we make that a little bit more user friendly. There's been some conversations about whether we move that into an app, and thinking about whether we actually have a BASW app. And the CRM is our internal process. It's our internal IT system that actually communicates with members, records members' details, almost like a case management IT system. And actually we think there are improvements in how we can use that to actually communicate with members, for example, around events and highlighting that. I think modern digital capability also refers to actually members wanting to become more digital in their day-to-day skills, and that's something we'd look at around practitioner skills and knowledge, but also digital forums. So that was the other issue that came up as a headline, actually establishing forums for our members to be able to link and connect and engage with other members about issues in relation to their work. Number 5 was a culture shift, in having a culture shift about BASW becoming much more confident in its approach, much more collaborative, and having a clearer focus. So you will see the bubble at the bottom on the right hand side. It says the Professional Association for All Social Workers, and that's a standpoint that I've brought into BASW that says actually we need to now be campaigning and talking to social workers that we are the professional association for all social workers. And what does that mean for social workers, and how can we encourage social workers to be part of BASW? And then the last key theme was an internal one, which was around governance reform and operational discipline. So that's about us getting some things in order internally, but I won't expand upon those. They're probably a little bit boring. Next slide, please. So we're just going to share 3 key areas with you today that really came out of the feedback. One is, how do we modernise our offer and engage and communicate with members and non-members? How do we create that bolder voice and advocacy on what matters? And the third one is about how do we develop specialist practitioner-led CPD, which people tend to think of CPD as a training workshop type event, but also how do we widen that in terms of developing practice guides. So we're going to take each one of these separately. I'm going to give you an overview from what the feedback said. Then we'll move into a poll in relation to one of those areas. And then Johnny will open up some discussion for us to have some discussion about that area. And then I'll move on to the second area, if that's okay. Lisa, do you want to turn the slide over? Oh, so bolder voice and advocacy on the bolder voice and advocacy on what matters. So if we look at what our feedback was on the bolder voice and advocacy on what matters, this is what our feedback has said. So number one, which is a really strong one for me, is to be our voice. And to be our voice, loud and clear and confident and assertive, not to be too apologetic. I think sometimes as a profession we tend to explain and therefore have be quite apologetic. So to be our voice, to be visibly leading national conversations, particularly around workloads and particularly respect for the profession. To have bolder, more powerful language, which is what we have actually started doing, to have a stronger public voice on social justice and anti-racism and workforce reform. So to get back to that social activism that social work is known for, to have a clear leadership and to clearly influence the wider stakeholder network. So for example, the example we've given here is about having owning standards. So if you're in England at the moment, they're developing early career standards. It's going through a bidding process, but that is something that I am saying to government that should sit with BASW as a professional association, so that as social workers, we own the professional standards of the profession. Reframe BASW's identity, that came from an external stakeholder, so that we can have more impact and credibility in government-led spaces. Provide national thought leadership on key areas, which I think is quite important from a practice perspective, to really address burnout, bullying and unsafe workload pressures for all members actually, and for independents. That's come through very strongly on a separate survey that we did. And interestingly, it's come out, it's the third year running, it's come out quite significantly. So when we finalise that report, we are internally going to be looking at that and seeing what we can do for members, in addition to what we can also do externally around creating a bit of momentum for change and pressure around those workloads. And then the final one from stakeholders about being bolder voice and advocacy was about us being the stewards of professional standards. So again, that's an example of the early career standards, that actually, because if you look at other professional associations, they tend to own the standards of the profession. BASW doesn't. We own the PCF, and actually we want to promote that more in addition to owning the other standards of the profession. Okay, next slide, and I think I'm handing you over to Johnny. So Johnny Adamson is our Communications and External Relations Officer, and he's going to be taking you through the next bit.
Thanks, Sam, and afternoon, everyone. As Sam mentioned a little bit earlier, we do have a very small kind of BASW panel today where I'm going to be asking some questions to in a minute on each of the themes that Sam's laid out there. So we've got Julia Ross is on the call, who's the BASW UK chair, and we've got Chantel Thomas as well, who is the BASW England acting chair. Before I go into my questions, kind of to give us a little bit of context, a little bit of feedback to sort of shape the conversation, we have got a poll, and I'm going to give you all kind of 1 or 2 minutes to complete that poll on our first theme. You can do this in 2 ways. There's a QR code on the screen, which you can scan to access it. And also, I think Amanda's just put it into the chat. There's a link as well. So I'll give you a couple of minutes now to access that and complete the poll, and then we'll delve into the conversation. If anyone has any technical issues, then please do flag them up, and we'll try and take care of it. Just checking, Amanda. Has everyone completed that? Might be one or two of still. Yep. I mean, the result is pretty overwhelming, maybe not surprisingly, but members want us to be focusing on working conditions. So my first sort of question around that then, and I think I will sort of direct this to you, Sam, is what strategies will BASW adopt then to address working condition challenges? Because they come through time and time again from not just our members, but the profession as a whole. And can we expect to see anything new or different from BASW on this area?
All right, easy starter question then, Johnny. Just yeah. And so when I joined BASW, which was about 2 years ago, I was very keen to have a working conditions campaign, really, because having come directly from practice, I could see that that was the number one issue for everybody in terms of the working conditions. And obviously, working conditions covers a lots of different things. So we did develop a campaign, and I was the executive lead for that campaign. In terms of beginning to have what were the asks of that campaign? Where do we want it to go? As with a lot of campaigns, it drifted a little bit actually. And since coming into this post, as interim chief exec, I've asked our campaigns group to re-emphasize on that. Number one has to be workloads. And I think the area that we will be moving into is to ask across all four nations to actually come up with a workload allocation system that gives minimum and maximum numbers. And that's enormously tricky to do from a political level.
Mhm.
But if governments can commit to, they are behind the idea that we do minimum maximum caseload numbers, I think it's then for each organisation to define how they do that. Now, I've been in social management for a long time, and we always had a caseload allocation model, always. So it's not a tricky thing. It's tricky, but it can be done, is what I would say. So I think that's the first thing. I think the second one is parity of conditions of service and pay, really, because we don't have parity compared to other professions, and we don't have parity within our profession. So in the local authority I used to work in, children's family social workers were paid the grade higher than adult social workers were. So it's really campaigning on the disparity that's in profession, but also comparative to other professions. So, for example, if you're a hospital social worker, you're governed by NHS codes of conditions, and they are higher and better than what they are if in a local authority. So that would be the second one. I think the thing that's become really shocking for me is that bullying and harassment figure. So over the last 3 years, when we've surveyed our members, between 38 to 42% are saying they're either experiencing it or have witnessed it. So that is something that I think that we have to build into our working conditions campaign. And then there's the softer stuff. So there's the softer stuff like it's called hot desking. How many of us on this call would hot desk, and how many of us have got employers that have been very proactive around hybrid working? What does hybrid working mean? Particularly, I think for MQSWs, you learn how to be a social worker by being with social workers, and that's a little bit more difficult around hybrid working. So those are kind of softer stuff that we're going to campaign and do differently. It does link to us having a bolder voice. And whilst people probably getting to know me on this call, I'm quite happy with a bold voice myself. And I have been bold to government where we said, but actually we need to now campaign much more boldly about those working conditions. But Chantel, who's perhaps closer to practice than I am at the moment, might have things she wants to add to this, Johnny.
Yeah, I'll bring Chantel in just in a wee minute. And thanks for that answer as well, Sam. Just before I do, Chantel, I should have maybe said as well after the poll, the chat is open to everyone to put sub questions in or comments as well. Really keen to hear everyone's views beyond just the polling. So if you have a specific question, anything any of the panelists say, then please do put it in there and I'll try and bring you in. But Chantel, do you want to come in on this question specifically just now?
Yes, I can. Yes. And good afternoon, everybody. Happy World Social Work Day, week, month. We are social workers right throughout the year. So it's nice to have a particular time to celebrate us, but we need to be celebrating ourselves each day. And just to reiterate what Sam said at the beginning about really taking time out for ourselves, for the work that we do, and just celebrating us because often we don't get to do that. Okay, right. That aside, working conditions, bolder voice. Now, absolutely. I think I'm not surprised either that working conditions coming out as the top priority. How are we going to be expected to work adequately with the families, with the children, with the adults that we need to be serving? If the conditions that we're working in are not fertile, if the conditions we're working in are hostile, if the conditions that we're working in, we're experiencing bullying, harassment. This is what members are telling us. This isn't a new thing. um, and there is something about the culture, the culture of social work and the culture of the organizations that um, we don't challenge enough. We don't speak loud enough. We're not bold enough when trying to challenge. And I'm particularly speaking about it from an academic perspective in terms of my students and the newly qualifieds that I work with in the day job, and what they're coming back and telling me about what's happening, on practice, what their PEs are saying to them, the power dynamics that's happening within work placement. How can we use our voice, or how can BASW, use the influence, the strength, the boldness, that we have and that we are acquiring and that we want to push forward, in order to challenge. And I think there's something about developing those working relationships. And I know there's a lot of work going on in the background about that, about really engaging stakeholders in those conversations. Social workers, we work in very complex and challenging environments. We know that. And Sam spoke about maximum and minimum caseloads and workload calculations. And while they're good, I think it's there's something about the complexity of the work that we do as well. And two, three social workers could have, 10 cases each. But if five of those are in court proceedings or, really, really high profile cases, that can take up all your time. So there is something around, managers, directors, really looking at the complexities in which, in which social workers are working, and actually implementing a model that is fair and just, across the board, and that may be subjective in some cases. I don't think, basically what I'm saying, there's not a one size fits all. There's something about having those conversations, something about being a bit bolder, and something about really looking at specifics, as well as trying to be kind of generic as well. I'll pause there and let Sam come in.
Just one thing.
Thanks, Chantel. Go for it,
That's
Sam.
okay.
I think one idea that people might be interested in hearing about, but it is hot off the press here, and I have got my chair Julia on here, and I've not mentioned it to Julia, I've not mentioned it to my exec, but within within a workload campaign, you need to introduce something called exception reporting. So what we don't have in our profession is exception reporting, and you see it in quite a lot of health professions, where what we're finding through our member surveys, that the volume of hours that people are working over and above contract, and interestingly, the amount of personal money that is being spent with the people that they're working with, that was quite a shock around that. But actually, I think as part of our working conditions campaign, we need to develop a national exception reporting framework that reports hours worked, unsocial hours worked, and also where we've had to use our own personal money. Now, lots of organisations do some of that, don't they? Lots of organisations do a time off in lieu. But actually, what we're not doing is saying this is a professional requirement and this is now a national programme, and therefore we can have the data and evidence to lobby more hardly, but also we can aggregate that data to say, look what's happening to the profession, whilst helping you as an individual that says, my professional association is now doing exception reporting. This is my exception reporting for this week.
Mm.
Thanks, Sam. Thank you. I'm just going to quickly come in, Johnny, quickly, just on that one, because
Yeah.
you just reminded me about that. Because in England, we are the London branch is relaunching in a few weeks, and that is something that they're looking at as well as the unpaid work. You know, I think social work is, if it's not the highest, it's one of the highest professions where we work, you know, so many hours. You know, I can't remember the exact number, but we work too many hours outside of what we're paid for. And there's something about us really aggregating that data and using that. And then there's even something about, you know, social workers stopping, making a hard stop at the 35, 36 hours in which they're paid for, you know, employers to see. And I know, you know, Julia can speak, you know, to that employer perspective, but for them to really see and appreciate, you know, the work, the hard work, the additional work, the additional stress, the additional emotion that social workers bring and carry and you know what that would mean if we didn't work those additional hours. So that was something I wanted to just to add as well. But thank you.
Thanks both. Rihanna, you've put in a couple of really important comments in the chat. First one around agency social work. I don't know, do you want to actually come in and talk to that one, or
Yeah,
would you rather? Yeah, go for it.
yeah, sure. So I was working in a very busy local authority. So we have a lot of agency staff coming in as well as we've got permanent. But what I've saw is that working in different teams, which could cause a toxic environment, is because when there's a lot of caseloads that come in, and then obviously the agency social worker sometimes managers may say practice. So if the agency social worker is to let go, or if the agency social worker wants to leave, they only can give a 1 week notice. So the caseloads that they're carrying, which I don't know if you're aware, but agency social workers are ground running. As soon as they start, they have to ground run. So they could get up to 25 to 28, 30 cases. So that could cause a detrimental impact on the other teams, which usually have a lot of student social workers, newly qualified social workers, and only scattered experienced social workers within the team. I also thought I was just going to put in supervision. A lot of this experienced social workers were not getting supervision, and that makes a detrimental impact on the way they practice. And because they're getting a lot of stress from their managers, who are getting stressed by their senior managers, this is causing a lot of mayhem in my view. While I'm quite an observer, I'm a practice educator, but obviously I'm a social worker as well, and I've noticed that a lot. And that's where the toxicity comes into the office, where there's other social workers talking amongst each others, and some friends are, you know, already in that place in the local authority, and that's where I noticed where a lot of horrible ugliness would come out, where they'd go into corners talking, but you could hear them. And it's the office that dynamics that I did. So that's why I thought this, in my view, I feel that I was going to say about supervision as well. When I was working in the local project, I did say that, is there any way that we can put in about all the social workers, I'm sorry, adhering to the PCFs and the SWEPs? Because believe you me, I had to actually demonstrate I completed a BASW section and a social work England section. And I feel that social workers, all of us, need to continue to adhere to the to the professional standards, the PCFs and the code of ethics. So we're still knowing what we're doing, but I don't think as soon as you're a social worker, it goes, unless you're doing your CPD. I understand social work England is, yeah, it's good that you're doing that. But apart from that, I don't think a lot of it is getting followed between you and me. That's why bullying and racism and everything's coming into something. It's all mixed up. It's all, so that's my what I thought.
Yeah.
So, but if something, if BASW could bring in, I mean, the PCFs, I use that with my students all the time and everything. But if there's something that we could put in that how important it is about supervision, as well as you know, and the toxicity in, like you say, bullying. It happens a lot. I've seen it in a lot of local authorities I've worked in, and even charity organisations. Not as much in charity organisations, but in a lot of local authorities because of the stress. Probably, I don't know.
Thanks,
But
Rihanna.
thank you.
No, no problem. You were breaking up a little bit, but we got most of what you were saying. And I think the supervision point's massive. On the PCF as well, I know BASW England are kind of doing a project around refreshing that just now. So we can maybe stick some dates in the chat for you as well, because it'd be great to get your feedback into that really specific project. Does any, Julia or Sam or Chantel, did any of you want to come in on anything that Rihanna said there? Julia?
Yeah, I think
I just come in. Sorry, sorry, Sam. Your voice is important. I just wanted to say three things very quickly, both on what Rihanna has said and elsewhere too. Because first of all, I loved the way, Sam, you were talking about I am saying to government. That is a very strong and important way, and the way that Chantel was talking too. So I'm chair of council. I don't deal with the day-to-day stuff, but I am just hugely impressed with the way that we are beginning now to be much more confident about what our voice should be and where it should be, etc. So wanted to say that. Second thing I wanted to say is that I don't know if you've heard this last week, but nurses in particular, and you remember I used to be a nurse before I became a social worker, nurses are looking at their workloads. We must look at our workloads. Of course we must, and of course we can. There are ways of doing it. So I'm really looking forward to that, and I welcome that. Thanks very much for talking about it, Chantel and Sam. Last thing I wanted to say, and I've forgotten it. No, the last thing I wanted to say was that we have a real opportunity now to do things differently. And throughout Richard's comments in the chat and other people's comments in the chat are to do with how employers behave. So I've been a director of social services for 10 years in Barking and Dagenham. How employers behave and our relationship with employers is incredibly important. And I'm really encouraged by what Chantel is wanting to do and Sam is wanting to do with employers, with the Association of Directors of Social Services, of which I'm a member, and the Association of Children's Directors. That is key. That is how we change perceptions too, and how we support the workforce. So enough from me, but thank you for listening.
Thanks, Julia. Sam, did you want to say something very quickly? And
No,
then
it's
I want to bring
okay.
in Richard as well.
I'm
Are you
mindful
okay?
I'm mindful you want to move on. I just wanted to pick up Richard's point, but Julia's done that.
Richard, did you have anything you wanted to add to your comment at all? You're on mute just now, but you should be able to come off mute.
I'm off mute, sorry. Yeah, that was an example in that when we moved to hybrid working after the COVID conditions. I mean, I work in a very, very big authority, although it may not exist in a couple of years. How they thought about reopening buildings, creating spaces. They didn't think about teams, and they didn't think about the importance of social work teams, especially adults, because I don't think we're considered as social workers often. Certainly in my authority, adult social work didn't really exist for a while. And they didn't think about, especially newly qualified social workers coming out, working from home, not having that access. I couldn't have done it when I started, if I didn't have someone to turn to. And they didn't think about that. And you'd go into an office and book that was one example. But I do think, as we go up through towards sort of strategic management, our kind of identity as social workers, we're just local government officers. We're seeing that very much now with the financial considerations, that sort of, we're about going to cut, when people need to go out and cut care packages and save money. That's what we're about. We're, our social work identity within an organisation gets lost. And I think that, you're talking to government, but talking to local authorities, because they are our employers and they need to understand social work.
Thanks, Richard. Chantel, do you want to come in on that point, and then we'll need to push on to the second point?
Yeah, no, that's fine. But yeah, just to echo what Richard said, because it just frustrates me, when social work is just kind of consumed by what's going on, or as he said, works in an NHS or what have you, and the social work skills. I think I'm going back to the bolder voice. Really, what you know, is really important for me, and it was something I wrote when I applied, you know, for the vice chair role for BASW England, was that when we're advocating, when we're, you know, champion for what we do as social workers, we have to be unapologetic about who we are as a profession, who we are as professionals, and ensuring that we are recognized for the unique skills that we have, you know, the ethical professionals that we are, but also for the expertise that we carry and we bring, and for those to be really, you know, expressed in all the different spaces, government spaces, policy making spaces, local government, you know, all the spaces that we need to be. Let us be there to champion that.
Great.
Thank you.
Okay, I think we'll push us on because time's running away from us already. So I think we need to go back to the slides.
Okay, it's back to me now.
Yep.
So I think we'll have to have a longer time next time, won't we? Where we just talk all things social work. So the second area of focus that came through really strongly from all our engagement, it was around having specialist practitioner-led CPD. And actually what that really meant was around ensuring that the centre of BASW is about practice and practitioners. And that's the bit I feel very strongly about as the interim chief exec. And how do we tilt everything that we do that becomes practice and practitioner focused? And this is what people told us, that they want better CPD and career support. They want specialist training and development to be affordable, and to be aligned to their career frameworks, whether you're working in adults, children, mental health, learning disability, hospitals, different settings, and actually that we then develop career hubs for people. So in the other slide, I talked about having online community forums that could also reflect actually these career hubs and be part of that. We then wanted to say the feedback was that actually BASW should lead on the professional standards and actually regulatory thinking. So Julia and I have had quite a lot of consultations with the Review of Social Work England, and we have both raised to the person leading on that review is where will these standards sit and where should they sit? And that's a really important question, because the regulator is the regulator. The professional association should be the steward of those standards and actually develop them, as we have done for those people in England with the PCF. And the PCF is a really good example of the profession leading the profession, because that was developed by members with members and is very widely regarded across all the landscape in social work, and it's very well regarded at a government level. So that's the other bit that's really interesting there. So that's one of the big things. That we should have greater focus on practitioners and education with clear recognised frameworks that are career pathways. So what that means is that BASW, as the professional association, should, with members, i.e. with social workers, develop career progression frameworks according to the area that you work. So children and families career progressions framework, and adults one, mental health, learning disability. And there are bits of that scattered around in social work, but they're not developed coherently. And we think we should develop frameworks that actually apply across all foundations, and that we own those frameworks and they become something in which the regulator then responds to and also government invests in. We also got feedback saying that we should have a strong corporate membership and NQSW pathway. So that's kind of two things really. Corporate membership in terms of what would be our membership offer to employers, and that has to be around strengthening practice and supporting practitioners. And we've got a pilot that we're just planning at the moment for a local authority in Edinburgh, actually, who are quite keen to work on us in that. But also to build early career pathways. And a couple of stakeholders particularly talked about NQSW, thinking that actually that's the point where people need it most. And in fact, Richard said that, didn't he? You do need it most at the beginning of your career. And actually, BASW should be not only developing the pathway and the framework, but also should be putting support into members who are at that point of their journey. And they also talked about specialist practitioner-led CPD. So CPD for me is learning. So it's whether it's a practice guide, whether you can go onto our website and download the latest best practice guide in your area, whether you get a podcast on it, whether we do a workshop on it, whether we do a conference on it. Actually, the BASW as a professional association should be the home of that knowledge and the home of that development to support members and non-members around their development. And coaching is part of that. We've got feedback because we've run a coaching program and it's been very successful, and people who've used it have really enjoyed it. And actually the feedback was that we should carry on offering that as a service to members. And then the bit on it's my left, hopefully it's your left, is about where do people access our resources the most. And that was quite an important thing for us in terms of if we develop a much stronger professional development offer, whether that's best practice guides, podcasts, whether it's workshops, seminars, conferences, where do people access that? And what we've found is that most people access it from the web, our social media, and also our bulletins, but that tends to attract members only. Those areas that have been mostly accessed around CPD is our professional capabilities framework and our code of ethics and our human rights. So that tells you that that's our most downloaded activity. It's the one that members really respect most. So it certainly tells me in my position, that's where I've got to focus. And that's why we want to move into being much more practice and practitioner orientated. Over to you, Johnny.
That's really helpful, Sam. Very comprehensive overview. Into the poll then. So this is what CPD do you prefer to access from BASW and best meets your training needs. So again, same as before, this QR code, there should be a link in the chat. So we'll give you kind of a minute or so just to fill that out. As you're doing that, I do want to come to Julia's just popped something in the chat as well. And I do want to come to you first, Julia, because I want to bring in AI, which is a bit of a tricky subject to always raise. And we probably don't have time to go into it in huge detail, but I do want to ask you, Julia, if AI can enhance the CPD offer that BASW provides, or are we at risk of losing our human focus? So you can maybe think about your response to that one as people are filling out the poll just now. Quite a nice split so far in the results. The online training courses seems to be popular just more broadly in the big conversation, so it's maybe not a surprise it's coming through as the most popular today as well. The person who's put in something BASW doesn't offer, that's interesting. If you're happy sharing that in the chat, that'd be quite interesting to find out. But Julia, do you want to come in now on the question I just posed around AI?
Yeah, I'll be really brief because I really want to hear what others are saying too, particularly members. So most of you know that, or some of you will know, that I'm really keen on AI and all the aspects of AI. It's not just the human bit of it, it's the way that AI can be used for predictive analytics, for example, and better use of data. So we've got a special interest group, and it's chaired by Christian Kerr, who until recently was a director on council, academic, and by Tommy Ray Henderson, who works as a social worker within the NHS on digital. They're brilliant. So for me, it's a question of not can they, but how do we do it? And so we need to grasp it, because if we don't, it will grasp us. And I'm looking forward to seeing that special interest group grow. We can do it. We need to have the confidence. And those of you who perhaps want to hear a bit more about it need to listen perhaps to the podcast that they have done, but also to Hannah Fry's work on television, where she talks about people who who are and do make relationships with avatars and have friends, or not necessarily friends, but people that they work with and understand. We're going to have to grapple with that in future. So fascinating world. Thank you. I'll shut up now.
Thanks, Julia. Chantel, can I bring you in as well? Because you're obviously practicing social worker. Is there any gaps in CPD that you think BASW should be providing that maybe we currently don't, or something that we need to do more of? Obviously, you're speaking from an England perspective as well, and Sam, you intimated earlier, of course, that it can be different across all 4 nations, and that's something that BASW has to grapple with as well. But from an England perspective, Chantel, is there anything that you feel that we should be looking at that we currently aren't?
Yes. So yeah, this question is again interesting theme that's come forward. I see social workers as lifelong learners, and it doesn't surprise me that CPD is something that always comes up. But I think what members are telling us, and what we're hearing, is that they want CPD that's grounded in kind of real practice experiences. So I'm saying that as an academic, and it's important to have theories and frameworks and everything else, and to have the research and understand what the research is saying to us. But I think what we're hearing from our members is it's that practitioner practice focus is what brings is that unique perspective, and it really brings the credibility and the authenticity, and it helps the work become more relevant. So basically what I'm saying is the most powerful spaces that I've been in where I've really learned are the ones where we can critically reflect on our work together in practitioner spaces. So I'm thinking about kind of communities of practice, and I know that's something I've discussed with Sam beforehand, but also something that's come up quite boldly in the England camp. We are a camp, but also in spaces outside of my BASW role. But those communities of practice is really important, where we can share and learn from each other. And I think it speaks to some of the questions and comments I was seeing in the chat about supervision, and the lack thereof, in some cases. And while this isn't to replace supervision, I think there is something about practitioners coming together to reflect together, in a structured way that really does help promote learning. So what I'm saying is, BASW has a unique opportunity and is uniquely positioned to help create and develop these practice communities of practice, and in particular these specialized areas as well. And these really support practitioners, as I said, share their expertise through workshops, through online spaces. Again, speaking about the digital, which we're going to come on about modernizing, but really the digital platforms where we can come together. But also, encouraging practitioners to write, to research, and to have reflective dialogues as well. Writing is something that I'm really, really passionate about as well. And not always just writing, as I said, for academia or for reflection or for research, but really writing to not only process one's own feelings and thoughts, but also writing to put one story out there for others to use in order to for others to understand and to learn from as well. So I'll pause on that one. But yeah, CPD is a massive one for me, and something that I'm really, really keen to take forward in the England camp.
Right. Sam, do you want to very quickly come in?
Well, I thought I had all these really interesting points, and then I got distracted with all the chat. I thought, oh no, I want to answer that. I want to answer that actually. Yeah, I would really like BASW to be the go-to place for best practice guides. That to me is really important for a professional association. We've been talking about supervision. We should do a good practice guide on what good supervision looks like and what poor supervision looks like. But also, I remember in my early days in practice, I was always a bit apprehensive about working with people who had quite serious drug health issues. Now, that's where I would go to my professional association, go, I don't know much about this. What can you share with me? What can you tell to increase my knowledge and development? It's things like that, using. And when you see emerging areas, So the work that we've done on the assisted dying bill is an emerging area, isn't it, for us as practitioners? Well, we should be saying this is what a guide looks like now for where we are, and actually then saying when the bill's finally passed, this is what it will look like going forward. And these are the issues that we have to consider from a practice point of view. These are ethical considerations, these are the practice considerations, and to be able to take it from there. I just want to add to Julia's point. Julia, I didn't know that you thought that, which is great, because I've always felt really strongly about Julia's point that actually social workers are absolutely excellent at collaboration and partnerships, and their communication and interpersonal skills are often more participatory than other professions, and we engage with people and bring them in and open up those conversations. And I think that is something, again, we could turn into a best practice guide about how we do that.
Yeah, perfect. I've just seen Alexandra's comment as well in the chat. I really want to move us on to the last poll, but Alexandra, very quickly, do you want to come in that comment at all? Because I think it's really a really good one, and it's definitely going to go into the big conversation feedback.
Yeah, I'm happy to. So we are at the moment heavily restricted in the funding, and that's not just funding to people in the community. That is also what we are able to do as practitioners. We are no longer allowed to attend outside events. We cannot do any unnecessary travelling. What's deemed unnecessary by the council, whether I agree whether it's unnecessary is something else entirely. But we just can't. So whether you are a neurodiverse person or have additional learning needs, you still expected to learn online. And it's challenging because I am a person that learns better face to face. Before the heavy restrictions were put in place, I attended acquired brain injury conference in London, which was one of the best things I've done as part of this role, but I can no longer do things like that, and that is just the case right now. So even though on the poll I put online learning opportunities, I put that, just want to make it clear, I've put that not because I agree, but because that is the only thing available that I can attend that is close enough to face. So yeah.
No, that's really helpful. I think that's food for thought for us. It might be one that we pick up on after today and maybe speak to you about as well. So yeah, really helpful. I'm going to push us on to the final poll very quickly, which is all about modernisation. Don't know, Sam, do you want to say something in that before we go to the poll? You on mute just now.
I'll just say briefly, obviously, part of us moving forward is also modernising and engaging and looking at how we communicate. So some of the initial feedback, which you'll just see on the next slide coming up, talks about us becoming more digital. I've already mentioned about the website being easier to engage in, having different content up there, about having more responsive communication channels, to enhance member feedback and involvement in national discussions. So to make sure they're two-way things, particularly when we engage on consultations, for example, and to modernise some of our digital platforms through social media, online communities and peer-to-peer support platforms for member, because I think, as Chantal said, that's how we learn the most. I think peer-to-peer from each other. We need to make sure that we obviously want to develop a digital community online to develop those forums, but we also need to make sure that whatever we do actually suits devolved nations in Scotland, Northern Ireland and Wales, and that we make sure that whatever we do from a community forum perspective or in our digital offer, that it reflects people's reality in devolved nations and actually how it would suit for them as social workers going forward in terms of the content, the language and the structures. More effortless support around our A&R service, which is always the one that's most highly rated, and also around our social work union partnership and what that offer is. And you'll see a little bit just above that point that our most effective channels are our email newsletters, social media, and also our magazine, which is also going to go through a bit of a review process. I'll leave it there, Johnny, because I know we're stuck for tomorrow.
No, that's helpful again. And I think the poll is what you value most as part of your BASW membership. So yeah, I'll give you another minute to sort of think about that. Again, if there's anything you want to put in the chat that sort of expands on what Sam's just mentioned there, then please do. We're taking all that's going in the chat today and feeding it into the big conversation. So it's all helpful. Yeah, just to say, MJ, that's a good comment you've popped into the chat as well. It does absolutely vary depending on a lot of different factors. And again, we have to take that into consideration at BASW, and maybe more, I don't know, more specialised and like if you're a student, these are the resources you should get and so on. So making it really targeted. Okay, before we kind of go into wrapping up, I don't know, Chantel or Julia, was there anything around the point on modernisation that you wanted to say before we finished?
I think maybe just very briefly, Chantel, while you're thinking, modernisation and moving and looking ahead is what we have to do to stay ahead. And I'm really excited with this big conversation, and I hope it continues. So thank you.
Thanks, Julia.
Yeah, I just echo that we have to. There's no if, no buts, no maybes. We really have to be future focused, really looking at, how we bring BASW up to the 21st century, meet social workers, meet students, meet newly qualified practitioners where they're at, and where they are able to, access resources, how they're able to, to learn, to grow, to develop, if they need support, we need to meet them where they are. So whether that's a new app, whether that's TikTok, whether that's learning platforms, whether that's online writing retreats, I'm really keen to understand, how people learn differently and how we best can reach social workers, because we do amazing work, and we need to be able to, to be developed in order to continue that as well. So yeah, absolutely, is what we need to be doing, is modernizing. Pause.
Thanks, Chantel. I'm going to hand back to you, Sam, to kind of talk about very briefly what the next steps are for the big conversation.
Yeah, thank you. So Amanda and Johnny are going through this massive exercise of kind of summarising all the feedback that we've got, but that some of the emerging things we've shared with you today. We know from feedback that we get that these are the four big things that are really speaking to us. One, that BASW is about protection first, because that's always the thing that consistently year on year gets rated most significantly. And that's through our advice and representation service. And it's really interesting because we provide an excellent service that's really rated very highly, not only in surveys, but also individual feedback. As a percentage, not many members use it. Now that's not a bid for people to use it, because you don't want to be in a position where you need advice and representation. But actually it tells you that actually people want, as a part of their membership, the security of knowing that they had social work led A&R services, advice and representation service, and that's a key part of our offer. And speaking up for the workforce, obviously we've talked about the working campaigns, but it's also so much more than that, isn't it? It's about being a bold, strong voice and making our position on practice issues and issues related to social policy and social justice very clear and very loud. And we are slowly pivoting in that direction to doing that. And you will see, if you follow us on social media, you might have picked up a slight tone in what we're trying to do, and to be very assertive about it. And I've been doing that at a stakeholder engagement level, mainly across Wales and Scotland, Wales and England at the moment, and moving into Scotland and Northern Ireland, about making our position clear. Speaking up for the workforce also links to employers, and I've mentioned that we are going to be developing an employer offer, and that we've started conversations with ADAS, ADCS and ADSS in Wales. So we started those conversations that are basically saying we're here and you have to listen to us. And really interestingly, they are listening. And I think Julie's had that experience, they are listening. So you get the sense that things are ready to change, really. Third message is what we've talked about through all this 1 hour session, is about being practice ready. And we want people to be practice ready. I want us to be the go-to around practice knowledge and skills, practice development. I want to shape that with members who are out there in practice, saying these are the key issues, this is where practice sits and this is where practice doesn't sit. I think that has to be for nation in perspective, because there are different legislative requirements, there are different roles in different legislations, and I think we have to be bold around our practice offer that's very nation specific. And I do think underneath that priority is a bigger question. Probably not for today, but probably one we would all want to have a conversation and spend some time discussing. And that bigger question is about what is social work, and what is it to be a social worker? Because that's what's under change here. That's what you see when any government intervenes. They're looking to shape what social work is and what therefore the role of a social work. And actually, Richard, you alluded it to yours in terms of social work in adults, which is my own background, being much more procedural led. And actually we want it to come back into the realms of it being a profession that's led by professional judgment, professional curiosity and professional autonomy. It's not just a machine that we follow through because an organisation policy tells us to. And the last area priority is about a clear membership offer, and that's come through loud and clear. It's also come through loud and clear on the chat, where a couple of people have said, oh, we didn't know there was so much on offer and that we could engage in. So we've clearly got a huge piece of work to do about making the offer very clear, making it tailored to different parts of people's career, but also updating people about things that we have developed that members might want to be part of. And the more members are part of it, the louder the voice becomes. So that's a really good correlation for me. So that's generally where we are. And thank you so much for joining us today. It's been fantastic to hear from you, from the polls, the comments that you've put in the chat. We will take this forward into our big conversation, so you will get your views and thoughts, and we will be sharing the final summary of our big conversation, and hopefully around April time, once we've had time to disseminate it. It is going to lead to some changes in BASW, so please look out for those changes, and we will be announcing those changes. But most importantly for today is just thank you for being the social workers that you are, and thank you for the hard work, the time, the commitment that you put into that, and for time and getting a bit of time in your diaries to come to this event and tell us your thoughts, but also support BASW, and in turn we would want to support you. And I will follow up a couple of the chats. Somebody's emailed me already, thank you, and so we'll respond to that. And hope and harmony, because social workers offer hope, and they bring that hope in harmony. And so take a moment to celebrate that. I've gone all goosey just saying those words, you say those words, because I do. So thank you, everybody, and please do join us on our other events, and have a good day.